people are going to schools of public health. People are training in public health. What we're a little concerned of is not sure that they are attracted to careers in governmental public health, working in local, state health departments, working at the federal level. And that's something that is challenging to us and we have to think through. At the state and local level, some of it is, just salaries. I mean, you can make a lot more money in other settings. One of the most interesting areas is IT, informatics. And we want to hire hotshot informaticians into public health, but the problem is we can't pay them a tenth of what they can make out in the private sector. And so unless they really have the social conscience bug, it's going to be hard to do that. So we need to find a way to address that.
From PHI Media, I'm Gordon Thane, and this is Public Health Policies to Watch in 2024, Episode 225, Workforce Shortages. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Remember our conversation in the previous episode with Dr. Marcus Plescia from ASTHO? He's the Chief Medical Officer there, and ASTHO is a nonprofit organization committed to supporting the work of state and territorial public health officials and furthering the development and excellence of public health policy nationwide across the United States. What you'll hear in this episode is mine and LaShawn's conversation with Dr. Plescia about ASTHO's Legislative Perspectives series that outlines the anticipated top 10 state public health policy issues for the upcoming year. This report is compiled based on a comprehensive scan of state and territorial public health departments' priorities and the current political climate. Here, Dr. Plescia talks about how the report came together. So I wanted to reconnect back at where we left off with talking about your role at ASTHO, and specifically something that I came across that I was interested in hearing a little bit more about that kind of process and the intentions of it. And it's around the publication around the top 10 state public health policy issues of 2024. And I understand that that's something that's done more or less every year leading into the subsequent year. So tell us a little bit more about, if you could describe what this is and the intended use of providing this information. What would you say to that?
We compile this every year. It's based on a scan of several things. Probably the most important is, what are the state health departments thinking? What are their goals? Where are their minds? What are they working towards? So we definitely try to align with that. It's also a little bit of scan, though, like what's possible. That document does help to determine our priorities for our government affairs work, our advocacy with the federal government. And so, we also look a little bit at what's the political climate, what can one get done right now versus what is totally off the map. And because that's pragmatic, even if something is of high interest, but there's not much way to move the bar in the policy stream, then it's not going to get as high of a priority for us. And then I guess the third piece is, what are our staff working on? Again, some of that is determined externally by what we're funded to do. But some of it is, we have a very motivated and socially conscious staff. And sometimes it's just an interest, like we need ASTHO to move more in certain directions. Our organization is very, very focused and organized around health equity. And I think that's a public health priority as well, but we would clearly be remiss if we weren't doing work on that, because we've got so much energy and passion for that in the folks that work for us.
For this conversation, we pay particular attention to strengthening the public health workforce as one of the top 10 public health policy issues to watch in 2024. There's very good reasons for this, as the latest estimates suggest that local and state government public health agencies lost nearly half of their employees between 2017 and 2021. On the healthcare side of things, we also see similar trends playing out, with shortages in a variety of professions like physicians, nurses, behavioral health professionals, and other primary care providers. Given this stark reality, I asked Dr. Plescia, what does it mean to prioritize building a more resilient infrastructure to retain and recruit workers? It turns out that we need to throw more than just money at the problem. There's 10 of them that were identified, but one of them that I was specifically interested in is the workforce element of it. And obviously, reflecting on the last 4 or 5 years with the COVID-19 pandemic, there were some identified shortages with the public health workforce and the healthcare workforce. So prioritizing that going forward means what?
Well, this is a real opportune time for public health in general, because through the experience of the pandemic, I think everybody realized we hadn't really made the investments in public health that we needed. And I think everybody also realized they're not huge investments. I mean, the amount of money to really get the public health system a little stronger is modest when you compare it to the many other things that we invest in through government. And so we have seen some of that investment coming down. And there is a congressional funding called the Public Health Infrastructure Grant, which we refer to as FIG. And that program is new money for state and local health departments to hire more people and to sort of augment and make their staff and their organizations more robust. We've never had that before. I mean, we get by, and if we want to do something a little different, well, you got to keep a balance. So if you want to hire a different kind of employee, you got to wait till somebody retires or leaves. And so this is the first time we have an opportunity to grow, and we need to grow. I mean, we need a stronger workforce so we're in a better position for whatever the next pandemic or epidemic or crisis is that comes our way. So it's exciting. There's a lot of reasons to be concerned and worried and discouraged about things these days. But the fact that we have this investment in public health, I think, is very, very exciting. And it's an opportunity to build what we need, but also it's an opportunity to be creative and think a little bit about what do we really need. And are there some new directions we should be going that we haven't gone because we haven't had the investments that we can go in now?
Okay, so it's clear that there's an issue here. It's also clear that there are many very smart people exploring different solutions to the various challenges that exist in the workforce in the United States health system, which I suspect is a challenge that many other countries are experiencing as well. In public health, though, we often talk about identifying the root cause. We're learning that a significant portion of public health professionals are leaving the workforce for a variety of reasons. But we also know that more students are graduating from public health programs than ever before. Yet, only 17% get jobs in government public health once they leave school, with many often citing challenges in navigating the current hiring process. Basically, people are leaving their jobs, and these openings are not being filled by people who went to school to fill those jobs. Huh? Make it make sense.
We talk about the public health workforce. We know that there's been losses in the public health workforce. Why is that? Why are people leaving? Is it burnout? Is it wages? Is it just the infrastructure in general that's not being able to retain these public health professionals? Because from what I understand, graduates of public health coming through these different programs, are they not going to the right places, which is kind of leading to a failure of human infrastructure? What's going on there?
Well, one big thing that has to be factored in is there's a lot of people who are retiring. And we knew that was the case. It's sort of the demographics of the public health workforce. And we knew there was going to be a time where some of these folks would retire because they deserve to retire. And I think that the pandemic may have sped that up a little bit because it was, stressful for people. And a lot of people who were close decided that it was time to go ahead and step into that. And, sometimes it wasn't a voluntary decision. Some people found that it just got to be a job that they weren't able to do anymore. So we lost people because of that, and we knew that was going to be the case. I think the rest of it is just sort of the flux of the field of public health. You mentioned something important is that people are going to schools of public health. People are training in public health. What we're a little concerned of is not sure that they are attracted to careers in governmental public health, working in local, state health departments working at the federal level. And that's something that is challenging to us and we have to think through. At the state and local level, some of it is, just salaries. I mean, you can make a lot more money in other settings. One of the most interesting areas is IT, informatics. And we want to hire hotshot informaticians into public health, but problem is we can't pay them a tenth of what they can make out in the private sector. And so unless they really have the social conscience bug, it's going to be hard to do it. So we need to find a way to address that. I think in the United States, though, the one thing that gets left out of the mix, because salaries are lower and not competitive, but many government jobs in public health have pensions, and that's most other jobs don't have pensions anymore. People don't always factor that in. And, knowing some of these people who retired, who worked in a state or local for their whole lives, I mean, they have a pretty good situation when they retire because of the government pension that they have. And so I think, we need to figure out, and I think that younger generation of people, I mean, they're maybe just not willing to commit and stay somewhere for 30 years to get a pension, even though they know the pension's a good deal. And so we got to figure that out. But that is something we're capable of figuring out. The other thing is, I think that state and local and government public health is kind of the bedrock of how we need to do this kind of work. But we may need to think about how to be a little bit more, can we get things done can we lead it out of the government, but maybe get some of these things done in other sectors, maybe contract more with academic sectors, maybe work a little bit more with public health. There might be some other ways to take this on, and we need to be creative about that and not threatened about that. Those of us who work in government public health, we think that's the answer, and it is in some ways, and there are things you don't want to lose about that. But we've also got to kind of adapt to the society that we're in, and sort of the generations that are coming in that may sort of want to do and approach things differently, but who will do and approach these things very, very well. Ultimately, it's just going to be a little different.
Traditional roles in public health include epidemiologists, biostatisticians, public health nurses, medical officers, health educators, and so on and so forth. However, when you do a bit of rethinking, you can't help but wonder, what is and who is a public health worker? The pandemic has demonstrated the value of community health workers, who were instrumental in outreach and vaccine promotion. Dr. Plescia highlights the need to continue investing in these community-based workforce, leveraging their unique capabilities to enhance public health efforts. He stresses the importance of using current funding to build and sustain this workforce, ensuring that it's not overlooked during periods of standard funding levels.
The one thing I want to make sure we get to on this topic, so this little bit of investment in public health is great because we need more public health professionals. We need more epidemiologists. We need more lab experts. We need more public health nurses. But this is the golden opportunity for public health to build more of a community-based workforce as well. We learned during the pandemic that community health workers were invaluable in sort of getting out into communities, persuading people who were a little bit on the fence to get vaccinated, working with people around contact tracing. I mean, we knew this was a concept that worked, but we never had the money to invest in it. We were able to do some of that during the pandemic. We need to keep doing that. We need to make the decision to build that workforce a little bit in our public health system now. I don't see that happening in a lot of settings, and that's why I'm a little concerned about it, because you can't build that when it's status quo funding. It's only during a time of this, when there's an additional investment, that people need to be creative and forward thinking and really look at how do we build that. The other thing about community health workers, you can also employ those people through community-based organizations. And that's the thing we've been criticizing public health. We don't work enough with CBOs. And this is a really good opportunity to do that and to play with it and experiment with it and see what works and how you structure it around something that's very finite, that we know the intervention, we know hiring these community health workers and having them work, we know that works. And so sort of working out the relationships so that maybe CBOs can do some of that as opposed to it being the government organization. I'm really enthusiastic about that, but I'm also a little bit concerned that I'd like to see that fire starting to really flame and happen in a lot of places. And I think it's a big shift. And so far, we're not. I don't know that we're taking advantage of that opportunity.
So much to cover in so little time. All right, so let me try and wrap all of this up. Yes, there are shortages in the public health workforce because professionals are retiring, younger professionals aren't staying in the same jobs as long as previous generations, graduates have difficulty navigating the recruitment process. Also, yes, there is inconsistent and insufficient funding for core public health programs in a sustainable way, and many other reasons also contribute to this. The report also highlights that many states and territories are aware of these significant workforce challenges and have taken steps to address it, whether that be through additional funding from the federal government, whether it be through reforming governmental hiring processes like Connecticut, Illinois, or Nevada, or increasing pay for public employees like many states plan on doing in 2024, or even incentive programs such as loan repayment and training scholarships. This just scratches the surface of what many states and territories are doing to address these more significant nationwide public health and healthcare workforce shortages. If you're interested in learning more, check out the links in the show notes of this podcast episode. Coming up next, the third and final installment in this 3-part miniseries, where we focus on the ongoing opioid crisis and the proliferation of nicotine products. That's next time on Public Health Policy Issues to Watch in 2024 on the Public Health Insight Podcast. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.